So now this study is basically looking at different bariatric procedures and also having a control of an overweight individual and basically measuring different levels at different time points of this hormone ghrelin. And remember, ghrelin causes hunger. So at time 0 is basically when these patients were given a meal. And you can see the blood levels of ghrelin in the blood of patients who had a gastric bypass, which is the bottom line in red. Also the overweight patients and also lap band patients. And what you can see over time is that patients who had the gastric bypass already at time 0, even before they eat the meal, their levels are already lower than the other two groups. And then over time, after they eat the meal, you can see the ghrelin level in the gastric bypass patient just go way down. So that means basically the feeling of hunger is really not there for a lot of the time of the day, even before a meal is eaten. And then after a meal is eaten, the levels go way lower than the band patients and also the overweight patients. Interestingly, in the lap band patients, which you see here at the top in green, you can see there that their level is high throughout the whole entire time. And it's interesting because I have talked to a lot of patients who've had the lap band procedure, and a lot of them do tell me that they feel hungry pretty much all times of the day. And even after having a meal, you know, or drinking something, they feel a little bit full on their upper stomach, but in the lower stomach, they still, for whatever reason, still feel hungry and they don't feel satisfied. And it could be because this ghrelin level is really high throughout all times of having the meal and even before meals. This next slide here illustrates a study where they were checking this hormone GLP-1, and this again causes fullness. So at mealtime, basically you can see this is in the bypass patient now in green, and this is an obese patient, and this is a band patient. So you can see already before the meal, the bypass patient, their GLP-1 levels are higher than the other two groups. And after the meal, you can see a spike up in this GLP-1 causing fullness in the bypass patients that you don't see in the other two groups. So again, you can see here as well that, you know, the hormone that causes fullness is increased in patients who have the bypass. Peptide YY, that hormone that people were getting through injections when they would have a buffet, that one study I told you about, this is how it looks like in their blood levels. And you can see the gastric bypass here on the top here, and then you can see the overweight and band patients below. And what you can see here also is the peptide YY is elevated pretty much throughout the whole time period in the gastric bypass patient, and in the other two it's way low. So you can see with all these different studies that the hormones in a gastric bypass patient compared to a band and overweight patient works to kind of help you succeed in a way, because it makes you less hungry, and the hormones that control fullness are higher than the other two. So these are some kind of hormonal data that shows how the gastric bypass works to help you keep your fullness and not feel as hungry all the time. This is one of our patients. Her name's Mindy. This is her before picture, and this is 11 months after, and she's lost a total of about 125 pounds now. She's about 1.5 years after surgery.